greater Knoxville region. We believe the technology industry is essential for our community to thrive. And I don't want to forget to ask you to please check out our website at knoxtech.org to learn more about our organization. And if you aren't a member, we would be honored or hope that you would be considering joining. We have quite a few upcoming K-Tech events this month. First is our Tech for Good virtual learning event, which is Wednesday, and that's May the 20th from 11:30 to 1:30. We also have women in the Tech virtual happy hour on Thursday, May the 21st from 5 to 6:30. And lastly, we have a K-Tech virtual happy hour on Tuesday, May the 26th from 5 to 6:30. You can check out these events tabs on our website for more information that will be posted as they come closer to occurring. And if you'd like to receive the most up-to-date information on the events and current news, please consider joining our email list at knoxtech.org. But I would like to thank everyone, and I would once again like to thank Lunchpool for their virtual hosting today and the platform, and I'm really excited about the event that we're about to occur. At this time, I think I'd like to introduce you all to our panelists and the first person that we're going to have speaking today on the healthcare technology and how they are handling COVID-19. The first person I'd like to introduce to you is Eric Mayer. And Eric, I hope I get all your bio correct because it's so impressive. I'm a little, even reading it from the script here, it kind of makes me in awe. Currently, Eric serves as the CEO of the EDP Biotech Corporation, overseeing the development and upcoming commercialization of Colorplex and a new diagnostic blood test for early detection of colorectal cancer. Just to let you all know, you all probably saw him yesterday. He was on the front page of the News Sentinel. If you didn't read that article, it was extremely impressive. Let's see here. If I could read the rest of your bio, let's see. Your passions are developing and launching novel biotechnology into the marketplace. He's previously been directed the business development activities of EDP Biotech Corporation and Biopet Vet Lab, and prior to that, developed veterinary diagnostics products at AAD Inc. His past experience in the human healthcare included I'm going to have to say this one, Metabolics Inc. Is that right, Eric?
Pretty good.
and Cyrus Pharmaceuticals. He's contributed to 3 publications related to cancer, renal dysfunction, and plague diversity. He received his bachelor's degree in biochemistry from UNC Chapel Hill and his master's of microbiotech and master's of business administration from North Carolina State University. And if you haven't read that resume, that bio before, it would scare you just reading it. Eric, I appreciate your coming today, and we'd like for you to give us your piece on COVID-19 and how it's affected what you all are doing these days.
Absolutely. Well, Tom, thanks for having me. Everybody at K-Tech, really appreciate the opportunity to talk today. I'm actually probably the odd man out in this crowd. I am not an IT person. I'm not a software person, not a traditional tech person. As Tom said, I'm biochemistry, microbiology, and biotechnology, which is essentially a lot of letters that say I probably overpaid for college, but hey, we deal with essentially human healthcare here at EDP. Kind of backtracking to earlier in the year before the coronavirus pandemic spread into the United States and before we had a lot of these shutdown orders, EDP was on pace working through clinical studies for colorectal cancer research. That is our core competency. Biomarker discovery, looking for proteins in the blood that indicate a person has a disease and try to detect that disease early. Colon cancer is a very devastating disease in the United States and worldwide. It is one of the highest incidence cancers. one of the higher mortality cancers outside of the United States. And so this was certainly a project with having a family history of cancer that I was very passionate about and wanted to get involved in. When the studies were finished right at the end of February, we were getting ready to publish studies, go out into the academic world and present our results at the large conferences that were being scheduled in March and April. And of course, all of the plans changed. I think very similar to everybody here back in March, it seems like the world was falling apart and things were slowing down. Events were getting canceled, and small businesses like us were wondering, what are we going to do? And so, we hit the pause button for a second, and we said, we need to really regroup. We need to take a look from a company perspective at what we are doing, where we're spending money, where our employees are going to get their sense of security. And from all of that, we were able to network in and discuss with physicians and other medical groups here in town what is needed to help respond to this pandemic. And one of the resounding answers we got, I know we've got John here from UTMC and we've got people from Covenant Health. We kept hearing over and over again, this was back in early March, that the physicians needed to know the prevalence of this disease in the population. And one of the ways that we hope to determine that and hope to collect more data on how this disease is spreading here in Eastern Tennessee and across the state is through antibody testing, serology testing. There's a lot of news out there, especially recently, now that the national spotlight is on both the FDA and is on these types of tests. There's a lot of mixed reviews out there, and there's a lot of, let's just say what it is. There's a lot of bad actors out there that are trying to sell tests into the market that aren't worth very much at all, aren't very good, and are actually producing poor data. So, for us at EDP, being a small company, being operated remotely mostly, we say, how are we going to filter through all this? How are we going to make sure that we are getting the right information into our business about what tests are available, which tests are authorized for use, which tests are the best performing, what other collaborators can we work with and share data, share information? How do you make sure that that information, especially if there's any patient information at all, HIPAA has to always be maintained? How do we make sure that we are compliant? These are all areas that are very new to us as a company. And so these are things that we are working through in real time. You all some of you, especially that have been in small businesses or entrepreneurial settings, you may have heard, you're building the plane while you're flying the plane at the same time. That's how it feels like now that we're in this coronavirus world. And we're adapting our blood testing capabilities and our diagnostic testing expertise and our personnel. We're transitioning them over to help fight this pandemic and get the data out to the healthcare providers that they need, get the data up to the task force in Nashville, and even collaborating weekly. We are sending data reports to the FDA so that they're collecting data also from our lab. That's probably the bulk of the IT stuff that I have to deal with. I basically have, we work with providers here in Knoxville. We consult out a lot of this type of IT related stuff. But I am more on the biochemical side. I could tell you everything about how these tests work on a molecular level, if there's any questions. But essentially, we are, like many small businesses, trying to not only survive this very strange time, healthcare-wise and economic-wise, but we're trying to position ourselves to be even stronger and be a better organization when we come out of this. And as people start going back to work, as the economy starts opening up, we want to make sure that physicians have the info that they need. We want to make sure that policymakers have the info they need. And EDP Biotech is a part of that puzzle.
Thank you, Eric. Anything additional? I do appreciate Eric. I know that we talk about technology, and from the ground floor up, and your organization is what I say right on the ground of the floor. And we appreciate it. Thank you very much, Eric. Our next person today, a presenter today, is Meredith. And Jared, I think we've not met before, but I do remember you from many other events that I've seen you at. Jared's title is Executive Director of Enterprise Architecture, Strategy, and Governance at TeamHealth. Jared joined TeamHealth in April of 2014. Jared loves to take current problems of technology challenges while bringing people together to align solutions and strategies to provide the best technology path for how we can work to achieve goals with technology. Jared's key roles and responsibilities include partnering with the CIO and executive team and strategic initiatives and upcoming projects. They provide portfolio guidance and directions based on the technology challenges. Serving as the Enterprise Architect Team Lead of the Enterprise Architect Team, which also covering the end-to-end discovery, design, review, and artifacts generation efforts. Serving, sponsoring the Architecture Review Board, SI Community of Practice. You have a lot of responsibility, Jared. I see this already. A community practice covering communication, creative services, and digital marketing, supporting the business development and recruitment team. Jared, I ask you now to please tell us a little bit about TeamHealth and what you all are doing with the COVID-19 in this new world.
Great. Thanks so much. I appreciate the opportunity to get to be here and to get to network with all of you. So I appreciate getting to represent TeamHealth on this call. Being at home, I don't have too much of my TeamHealth branding. The best thing I could find was like a little Post-it pack that I could wave for today's call. So that's,
you don't have a shirt. You need to get you a shirt. And and EDP on the other, Eric's T-shirt. He's advertising.
I know he's definitely
today.
Won that competition today for sure. I'll have to get my branding tips from him. At any rate, we're so glad to be here. I thought it would be fitting in making sure I'm using this the right way. I would like to share a couple of photos to help tell the story around some of the things that I'm proud to be a part of with TeamHealth. So for TeamHealth, our core business is supporting all of our clinicians that are in the field across the greater 48 states where we have business. This traverses across multiple service lines. And, we continue to campaign and come together around this notion that during this difficult time, that our clinicians are one of the many heroes that are out there and all of the workers at all levels that are making a difference. So, that is what our work is centered on. That's where our passion is, to help support these folks that are out there making that difference. If I can flip over, yeah, I think I see it there. This was another photo that just really brings to mind, the sense of togetherness and the way that we support people. This is a husband and wife nurse pair, just capturing a very special moment with them. And it really just reminds us, that beneath all of the equipment that people wear and all of the work that they are doing, that ultimately there's people behind all of that. And, these people are putting their lives on the line every day to help tend and provide care for all these individuals that are there. So I just wanted to start with those visuals to help me drive the message home that we're really centered around our clinicians and making sure that they feel supported while they deliver the highest quality care to everyone that's facing this difficult time. One last visual that really segues me into some of the topics I want to talk about today. In light of the fact that we have had some of our administrative associates not being as much in the office due to the impact of this, we have found that we have rallied together in different ways and are reusing spaces that were typically for conference rooms where we had a lot of people in the room. Now, we have PPE delivery teams that are working to order as much equipment as we can and to send it to our folks that are in the field, helping them to continue to make a difference and not have the fear and worry about coming into a shortage of that equipment. So if I would speak to anything, I think part of this crisis is causing administrative workforces that are supporting clinical audiences to do whatever we can to help them be, feel safe at their job, to not have to reuse as much equipment where they can, and to really establish a sense of community with them in terms of making sure they feel supported and that they know that we're thinking about them during these events. So I think that's a really good, telling story, not only for TeamHealth, but for organizations alike that are all trying to figure out what is the best way that we can make a difference to those that are either struggling through the crisis as people, or for those that are trying to deliver high quality of care across all healthcare lines of business. So I thought it was cool to just show a few of those visuals just to highlight the importance of that. If I was going to just talk, for a couple minutes on a broader message around technology specifically, I would say that all businesses, not only in this area, but through our nation, have been challenged by way of understanding how teams will begin to come together in what is now our current normal. A lot of times we had the convenience of being in the office to pop around the corner to ask someone a question. Now there's a couple more steps that may be involved in that process, right? So having technologies that allow us to have stronger video-based communication that allow for collaboration are especially powerful during this time. And as I crack a joke, it'd probably be a good time to invest in a lot of video and telecommunications softwares if you're an investor, because I don't see this part of the market as slowing down. If anything, I think this will challenge us to make the experience of all of the applications we use to collaborate and have conversations together to be as intuitive as they can be. In terms of IT specific things that we faced, we've definitely seen being challenged by way of making sure that our business continuity plans, held in place. I'm proud to say that as a part of, an effort with our IT organization, it's spanned across a lot of teams, but we went from basically having roughly, over 1,000 or more VPN connections on average. That was typically the volume that we would have, out of a 5,000 or 6,000 administrative workforce count. As a result of these recent changes, we've really scaled that out to 4 times that size. Those things just don't happen without a lot of effort and coordination. So I think something that we've noticed in this process is making sure that our delivery of equipment, getting a succinct and coordinated effort to get associates equipped with what they need to do business has been extremely important. And I'm proud to say that we've been able to accomplish that, and we are doing as much business as we can in terms of administrative support now. Another thing I wanted to highlight in terms of, innovation that challenges you to think differently, for people that don't have the leisure of getting equipment home with them, or if, they were in a situation where they were coming into the office and it was more wired down and not easily movable, we were able to, with the efforts of many, great team members, to automate, from the point of a service request form to be able to generate, a VDI-based solution that's connected to all the technology with an approved image that people could leverage. So within roughly an hour to an hour and a half period of time, our associates are able to, from a personal machine as well, get to company resources that are talking to all of the right systems and information. So when you're in a situation where you have to evaluate whether it makes sense to order equipment and ship that out, and it being a week and a half, 2 weeks before someone can be online, versus letting them leverage BYOD and using automation to get them up and running in less than an hour, those are the kinds of things we're looking at now, not only for how we support through the rest of this, but to also think about how this affects us more broadly over time. If I would close kind of my remarks from here and hopefully be able to take some questions, we are at a point now where the conversations we're having today as a company, and I think broadly in IT in general, is, has this event created a rift and a shift in the way we do business, where working remotely is not so much a casual thing, but it becomes the new normal for a lot of associates? And how does that shift or influence the architecture that we begin to lay out over time, so that our business continuity is supportive of not only people that used to sit at a facility. But if we cause a permanent shift to that, can our technology support that? Do we understand what the cost looks like in terms of how we support that? As well as, do we have a good grasp on the technologies that we would need to do our business securely? So I think that that's a part of the conversation, that I hope that we can network on today and talk a little bit more about, because I think all companies are kind of waiting to see where that ultimately is going. At some point, we all have to draw our line in the sand to know where we are comfortable in terms of that balance of people that are back in the office one day versus people that may be recommended to be more working remotely in a long-term stint. So I'll close right there. I do thank you for the chance to just get to open up, highlight some things about TeamHealth, and to talk a little bit about what we've done in technology, as well as just things to be thinking about in the broader IT landscape. So thank you very much.
Thank you, Jared. I would like to personally just say the thank you that we extend to all of your physicians, and I know you're in 48 states, and I'm trying to figure out what 2 states you're not in, but I know that they are on the front lines of this situation. Their lives have been changed forever, and I know that it's not just individually, but that's a very personal situation with them.
Right. Yeah, that's greatly appreciated.
Thank you. Any questions that anyone may have for Jarrett right now?
Sounds like they're letting me off the hook easy for now.
It looks like that way. I'll spearhead that later on if they're not going to make any questions for you. But well, if we would like to maybe move on now to the next panelist, and I would the next 2 panelists, these gentlemen, I've known both of them and or known of them for many years. If I'm letting Alex here bring up Mr. John Jeffries. John Jeffries, thank you. There you are, John. I see you, sir. John is the Chief Information Security Officer for the University of Tennessee Medical Center, where he's responsible for leading UTMC's diverse information security and its IT risk strategy. Prior to joining UTMC, John served in the military for 23 years in active duty in the U.S. Navy. He joined the military in 1989 and served on board various naval ships, aviation, and submarine squadrons. After completing his service in 2013, he and his family moved back to home in East Tennessee. Outside the office, John is an active member of the cybersecurity industry. He's volunteered to lead campus visits and discuss about cybersecurity with local community colleges in Knoxville with their cybersecurity students. He participates and supports the local ISSA chapter meeting. He's organized meetings with other cybersecurity professionals in the East Tennessee area and is a member of the Knoxville Chamber InfraGard team. He's received his master's degree from Trinity University. John, I've known of you for many years, and I certainly heard of your name from the security groups from everywhere, and I'm looking forward to seeing what you and your staff there at UT have done during this whole COVID-19 situation, John.
Thank you,
Tom.
Sir. It's a pleasure to be here. I'm honored to represent UT Medical Center and be able to come and meet all the industry leaders here. We've had a wonderful, challenging opportunity over the last several months to lead our team to work and doing a lot of remote work. We've had a lot of challenges with, obviously, as each industry has, but one of the things that we focused on most over the last couple months has been making sure our users, our workers can access our systems securely and use the tools that they have effectively. We've had many challenges with that, but I'm very happy to report that we've been able to overcome most of those with the help of our different vendors and different resources we use. We've partnered with reached out and worked with Mike Ward and his team and TeamHealth and all the different other healthcare industries here local, and just really been united in this effort to see Knoxville overcome this and be successful. My team specifically, we've been working on a lot of different projects. One of the challenging ones are people logging in remotely and doing it securely and using their BYOD. And so we're having to strengthen our BYOD policy a little bit more and engage with some outside vendors to help us with that. We're a big Microsoft shop, and so we use them a lot. And so we've been exploring a lot of different options there, and we're very excited to continue to grow and continue to see good things come. And we want to just provide good customer service to our patients, the families, and our partners we partner with. It's definitely an opportunity.
Okay. Anything additional, John, that you may want to tell us about the team? I know that when people talk about UT Medical Center, they don't understand. It's not just a medical center; it's also a teaching place. It's also physicians and so forth. The challenges from the security and risk, has that been a large? I know it's had to be an endeavor that you never expected to be doing at this time.
Absolutely. We've had many challenges with that, and we've been able to work with the different teams at the hospital and work with the nursing staff and the doctors and just try to figure out the best solution for, telemedicine, and doing a lot of work with that and working with Microsoft on the solution for that. And so it's just opened a lot of doors for us. And as Jared said earlier, it's not going to be the same as it was when this is over with. We're going to evolve, and we're going to grow, and we're going to continue to develop. And so that poses a different risk. And so we have to figure out what is the best route to deal with that, and just deal with it head on and try to make the best decisions.
Well, I'm gonna sort of say some of the same things I said a few minutes ago about TeamHealth. I do appreciate your all's work and your, I guess I hate to say it, they've had to risk their own lives to protect the community. And I feel like that we've done a good job of that within our community. And, like I said, TeamHealth, 48 states, now we're coming down into what I call the 5-7, you're a priority one institution, we have a lot of, issues, not just, it's not just COVID-19, but we have, accidents, we have people in serious injuries and serious diseases and so forth that we have to deal with. But I thank you all for your work.
Well, I appreciate that. Thank you. We've got some real heroes we work with, and they sacrifice every single day. And I was in the military before this life, and I worked with a lot of heroes there too. And it's an honor to be with this team and work with them. And each day I'm very thankful for that opportunity.
Thank you, John, very much. As I move forward in our agenda this afternoon with our panelists, I'm going to tell you all before I even make this introduction. Mike Ward with Covenant Health. Mike and I have been personal friends for 40 plus years. I actually came from I guess what I want to call a healthcare environment before I was with US Bank. But let me please read Mike Ward's bio, because I know it so personally I could almost tell it myself. Mike is the Senior Vice President, CIO of Covenant Health, obviously a Knoxville-based healthcare system which includes 10 hospitals and over 110 physician practices across East Tennessee. He also serves as the president of the board of the East Tennessee Health Information Network, which is ETHINS, a regional health information exchange organization, which serves a 23-county region of East Tennessee. Prior to joining Covenant in 2003, Mike was with SAIC, Science Applications International Corporation, for 23 years, where he served as the Assistant Vice President and Director of Systems Integrations, where he managed software development teams in Oak Ridge, Tennessee, and and Virginia, serving a variety of industries, agencies in both the private and public sector. He received his bachelor's degree in computer science from the University of Tennessee. But Mike is, as I call, a blessed man. He's been married for over 36 years. He's a proud father of one daughter and two sons, and he's a grant for two grandsons and one great granddaughter. I'd like to, at this time, give the floor to Mike Ward. And Mike, thank you very much, sir.
Thank you, Tom. I appreciate the opportunity to come today. I'm excited to share about all the technology and the impact that Covenant is working to make. And as John was talking, and also as Jared, I want to speak to, and we really don't have the opportunity yet for much of a relationship business to business wise with Eric, but across the Knoxville community landscape, there's a term that we've used, and it may be old hat now for some, but it came out back in the early 2000s about co-opetition. And that's something that started really with ETHN, the Health Information Network, because it's something that UT, Children's, Blunt, at the time, Tenova was also a part of it. But it's something that we've all worked, because we said the technology is not something that really should differentiate us. It's the care that everybody provides and locations that differentiates us. But we all try to level set that technology base because it's better for the community. So I'm going to jump into Covenant's had some huge investments that we've made, not so much in money, they are, but we had already had a plan in place going into 2020 to take and proliferate this telehealth technology. And the thing that COVID-19 did was just pushed us into hyperspace, to use an old Star Wars type terminology, because we went from a very slow plan that we were going to go across 2020 to be more deliberate and disciplined, not so much for the technology people, but for the clinicians, because they wanted to be deliberate in their process and how it got rolled out. But we just pushed the fast forward button. So we rolled out one of the big things that's been a help for the community. We put out something called MedChat. If you go to covenanthealth.com, they've labeled it as Helen, I think. They try to personalize it. But it's a 24/7 chat bot that the community's been interacting with. We've typically approached about 100 per day there in the 2-3 week period of April, where there was a lot of sensitivity and heightened awareness and interest in trying to understand. So it's a triage process by which people can sit in, and the technology can help them triage. So only 100 of those that interacted with the bot, only about 15 a day from a max perspective, actually interacted with a nurse. And while it's good news for the community, only about a handful, on average 5 a day, were actually going to a triage service to interact with a physician. So that's been a great technology. We actually turned that up within a 4-day period. It was quick and easy to use and able for the clinicians to have an impact to the community. We've also spun up. We were on a slow burn for telehealth for virtual visits, where typically it's a demographic where it's women that are going to be age 25 to 42 that are trying to use their phone to provide care for their families, because they're the primary caregiver demographic. We went from only less than 10 physicians that were able to do that to we spun it up within a 2-week period, and now we've got over 330 physicians that are working to provide that technology across the community. We had 8,000 visits, virtual visits that they did in April, averaging about 2,000 a week. We expect that to grow, because what we're finding is, which is no surprise for everybody, if you can do it over the phone and not have to travel and get into the office and expose yourself to the flu or COVID, or I'm the primary caregiver for my 89-year-old mother, and so it makes it really easy for me to be able to pop out my phone and interact with a physician in her presence, as opposed to load her or walk her up and get her to the visit, get her in the door, get her out of the car, get her in the car, get her out of the car, get her in and be able to see, just because she's at a high risk population, COVID-19 or not. That reminds me that, there's something that when you look across the healthcare setting, a lot of the community has been overly concerned about COVID, and it is something to be very concerned about. But infectious diseases are not new to the hospital community. It's something that we've all been working to deliver when there's a significant care issues, whether it's emergent through the EDs or it's chronic in the floors. It's something we've been doing for a long time. So it wasn't new for us. It didn't catch us by surprise. We were all worried about the volume, because when you look at New York and some of the other cities, you think that, oh my goodness, we're going to be overwhelmed. And we were prepared for that. But, thank the Lord, it didn't happen that way. It's something that's still much in control. If people practice the social distancing and all of the protective equipment and things that folks are putting in place, then we expect to still be able to manage it. We've got that. So when I talk about that, so far, that's across the practice in the ambulatory setting. We've also enabled that for behavioral health, because folks can come into the EDs and they can have, significant emotional events, behavioral events. And so that's something that also allows physicians to be able to provide that, not only in Knoxville proper, but as Tommy mentioned, the 23 county region around Knox County. We've got 10 hospitals, those 110 practices are scattered out. And so we're able to deliver Knoxville level care out into the rural communities through the technology. And so that's been a great experience, not only for us IT to deliver it, but for the patients to be able to experience, because they benefit from that. Just like my mother, I drive my use cases to make the technology good and work for my family, is to be something that we do for all patients across Covenant. We've stood up collection sites all around those rural communities, and that's something to enable them. They don't have to drive and wait in the Knoxville proper area. They can go to Crossville, Roane County, Loudon, Anderson, Sevier, Hamlin, Claiborne. And so it's something that technology enables us to really get out quickly. So I'm going to flip over. So that's all been practice-based and ambulatory-based. From the hospital side perspective, one of the big wins that you hear a lot about on the news is the PPE, the protective personal equipment. Well, we've got what we're talking about is virtual PPE, so that we can put the technology in the room with the patient. You don't have to have this in and out of the nurses or in and out of the physicians, only when absolutely needed. And so one of the big challenges that all the facilities, the medical facilities and practices that are seeing around Knoxville is, if you keep using up all your masks or your gowns or your gloves or your booties, what they wear on their feet, when it comes time to being back to normal business, we're not going to have any of that, because it's hard to come by in this day and time. This virtual PPE allows the physicians to deliver that interaction and the nurses to deliver that interaction. If the patient can do it without assistance, great. If the patient needs assistance, then you've got someone that's gowned up and they're in that area trying to help provide that care. But it's only one that's gaining the exposure, not the whole care team. We've had a lot of virtual visits that we put in place. One of the great wins in collaboration we've got is virtual nurseries, where Children's Hospital in Knoxville is providing that virtual nursery care out to the surrounding areas and counties. That's a big win. We've had telestroke, telecardiology, telenephrology, such that you gain big city expertise with the physicians out into the rural areas. And so again, that's technology enabled, and it's just been huge. When we look at the peripherals that we've got, you can get stethoscopes, you can get otoscopes, you can get derm cams. There's all kinds of monitoring that's in place now that's enable us to support the patient in the acute setting, but also in the home setting. And so that capability allows us to enable that and keep the patient where they're comfortable, if they can be, if they've got the technology, or we can make it work quickly, cellular-based or home network-based. I mentioned the behavioral health that we've stood up. That allows us to be able to, whether across the continuum, as folks come into the ED setting, if they go to a behavioral health setting, if they're in the nursing homes, if just various settings across the community. Again, that's a capability that we get into, teamed also with Helen Ross McNabb, because it's a mobile crisis capability that we're able to support. That pretty much covers it from the care settings. When you look at the virtual meetings, I was going to recount some of those. We were having on average 44,000 meeting minutes a month all of 2019 and early in 2020, but in March it jumped to almost 300,000 meeting minutes. Just as the whole care teams across Covenant came together, and instead of getting face to face, even though we still do that a lot and we've got our protection in place, there's also now a big need and big use of the virtual technology, much like what we see here with Lunch Pool. It's something I've really enjoyed seeing because that's a very unique and very innovative way to allow people to be able to come together and interact that way. We're projecting that it's going to be upwards of 375,000 meeting minutes for April. We don't have all those numbers back yet, but approaching 400,000, and it's going to be interesting to see if it stays up that high or if it comes back down. Like John was talking about, and also Jared was talking about at TeamHealth, we had to increase our VPN capacity. We've increased that by 5. We didn't get to where we maxed it out, but we can measure our utilization, of course, and whenever we anticipate it going past the 60% point, which that happened, and we've flipped the switch and we've increased that. And as of next week, we're looking to go from a 1 gig internet pipe to a 10 gig internet pipe because we're expecting this utilization to continue, and we're going to be ready for it on the IT side of the house. Security wise, we get bombarded. I've asked my guys to double check it because I didn't believe the numbers. We were getting over 1 billion pings. It used to be a year, but now starting in 2020, it's gone up to where we're getting it on a monthly basis. The numbers are unimaginable because now we're up to 600-700 pings a second. We've got country blocks in place such that we don't let all that outside the United States noise come in. If we need somebody within a foreign country that's provided services, and we do have that, we have specific IP addresses, we allow it back in, but it's just unmanageable when you see during this time of crisis, there's been such an exploitation. There have been local folks that have been fallen victim to phishing, and so I remind everybody, if you've got my name in your contact list or Tom's or somebody else, because if you get to Tom, you're going to get to me. It's that networking that exists. Everybody's got across the community needs to be sensitive to that capability and that exploitation that can happen. So with that, I'm going to shut up. I could talk. Tom knows I could talk longer than you'd want me to talk.
Well, I do appreciate it, Mike, because you have went across the gambit of all those pieces, from mental health to ambulatory to hospital to physicians. And I know many years we all spoke about telemedicine as being the thing for the future, and we kept talking about the future is never going to get here, but all of a sudden the future has arrived. It has arrived. Well, Mike, I do appreciate you and your presentation today. At this time, I'm going to kind of open it up to the audience to ask questions and so forth. If I know that I've watched a little chatting over here on the side, it's time to ask. Is that time to ask these panelists some questions? Anyone got anything they'd like to ask? Please help me, Holly and Alex. Any questions here? Well, okay. If nobody's going to ask a question, I'm going to go ahead and question. Do have?
Yeah,
go ahead,
there's
Alex.
the Q&A tab over here. So if you guys have questions, so they don't get lost in the chat, be sure to utilize. I should have told you guys that at the beginning. Sorry. But if you look over to where the general chat is, there's a tab at the top. There's chat, participants, and then Q&A. So there's already some questions in there. I should have pointed that out. But you can ask your questions there, and we'll address them one by one and kind of check them off. So Tom will be filled those, and he'll assign them to the different moderators. So good questions in there, though. Yeah, definitely want to address those. So thanks, guys.
I guess I'm gonna kind of address this first question to Mike. Has there been an uptick in the mental health issues, and are there enough resources in the community to help with the mental health care, Mike? What have you all seen?
Well, there's certainly been an uptick in the activity because it's a stressful time, and what people are needing. It's much like that med chat, that nurse chat that we talked about, because there's a triaging that folks will go through. And it's the same thing from the mental health side of the house. There's a triaging that's done. And so while you have a high level of activity, it's almost like COVID-19. You got a high level of testing, but there's not a lot of positives. And so the bad news is that we have seen a lot of folks with anxiety and anxiousness, and they can get to the point of being overcome. And in some instances, that even ends up with them being hospitalized because they have heart attacks. They have issues that anxiety manifests itself in a very physical way. From a capacity perspective, we've got enough resources to cover it, just because when you look at the real triaging aspect, it's not a mental health issue underlying it. It's the mental health is just one aspect that comes out, but it's the physical health that once you address it, the mental health calms down.
Yeah, thank you. I'm gonna keep on with some of the questions that are out here, and I'll send the next one to Jarrett there. Jarrett, since I know TeamHealth is basically physicians and in emergency rooms and so forth, how are the physicians, or what I say clinicians, adapting to the need for this remote care? Or how are those physicians in those emergency rooms or and so forth that you all have at different hospitals across the nations? How are they adapting?
Yeah, that's a great question. So in terms of something I think that is more visible and understood just based on the media coverage of it, I think some of the adapting that's had to happen is by way of how we have created a degree of isolation when people are providing care. So I've heard many stories and seen many stories in the media about folks that are unable to actually be in the facilities with their loved ones. So without technology in those situations, it's really tough to have that coordinated response from the people providing care to the ones that are interested in caring about their loved ones and wanting to know about their well-being. So technology is really helping to bridge the gap for people to be able to talk and collaborate and have conversations with family members. In terms of remote care in general, at least with TeamHealth, and I think we've heard it from other speakers today as well, we are continuing to expand the capabilities that we have around telemedicine and making sure that we are accommodating all of the needed security measures, as well as agreements with our facilities to be able to use that type of technology in the field in order to provide, quicker quality of care and minimizing the impact or risk that people would have to take in terms of being able to do that remotely.
Okay, thank you, Jerry. John, I'm going to kind of give you, and just to let everyone know, I'm taking the questions over here and I'm kind of rephrasing them just slightly for different people. But John, how large of a concern is the security with the new implementations of these new technologies and the new measures that we're going through with all the technology? How large is that concern in the security field, John?
I think in the security field, it's very significant. I know at UT Medical Center, the senior leadership talks about security measures we have in place, and we have a 3-year plan of security measures we're trying to roll out. And then as the instances like the coronavirus, the challenges it's presented, I think that it's brought it to light, really risen to the top of a concern. I'm very pleased with that because attending conferences over the past several years, I've heard a lot of information security officers talk about how that the security isn't a concern in some companies, and it's not a priority, and there's not much funding for resources. But I think in the healthcare industry here in Knoxville, collaborating with the different hospitals and my counterparts, I see that there's a significant concern there in the leadership to be secure. And as we continue down this road, we have to even step our game up even more, and we have to collaborate more and work together. So I'm pleasantly surprised at how that this has been received and embraced, and we're developing and working together to continue on stronger.
Well, I know earlier, John, you spoke of you all being a Microsoft, institution. and I know that I'm sure that there's Cisco involved with that. How have those partners engaged with you during this whole COVID-19? Has it been, are you like priority one? Or are you like, how have you felt that whole collaboration and effort has been with the other partners that I'm sure you've had to work with on security?
We have met weekly, if not almost daily, talking about ideas and dreams and the vision going forward. We've had a lot of discussion, like with the other CISOs at the hospitals, and just trying to develop a plan and then go to our vendors and say, hey, this is what we want to do. How do we do it? And how do we do it securely? And really just brainstorming ideas. And, it's been very amazing to see the results that come from this, with all the different teams collaborating together and trying to develop a secure solution. And I'm just, like I said earlier, I'm excited to be here, and I'm excited to be able to talk about the great things that are going on. And there's a lot of hope out there. There's a lot of positive things that are coming from this, and a lot of good change.
Okay. Well, I'm gonna switch gears just slightly, Eric, here to you. And Eric, I know that your company has been working with trying to develop technologies to look at the COVID pieces here. And I'm taking some from the paper yesterday that I got from the News Sentinel. How has your team, or how do you envision, Eric, in the future testing being done for the person? Are we going to make this somewhat like a pregnancy test that they are at home? Is it going to be something like we do from diabetics, a blood test? How do you envision, Eric? What's your vision? What do you see?
I think you're absolutely right. I think that these diagnostic technologies are going to move closer to the point of care and into the in-home setting eventually. There is right now one that I know of, one FDA emergency use authorized in-home test where the patient basically spits into a cup, for lack of a better technical term, and then provides that saliva to the reference laboratory. I think that the high complex diagnostics will still be performed in a clinical setting, potentially in a physician's office, but right now typically in a hospital core lab or in a reference laboratory. There's a lot of talk about creating new devices similar to the blood glucose meters, where a patient can do a small pinprick at home and take that measurement at home and potentially relay that data to a physician. These are all things that are going to be coming out, absolutely. And I know that there are several already in the works. I think that is where this type of test will go. I don't think it will ever fully replace the clinical setting. And, as I said, the reference labs and the core labs that produce those high complex, highly accurate diagnostic results. And, just real quick, I don't want to monopolize the time, but, in terms of the mental health question, that's something that's very personal to us. I have a child with a diagnosis, and my wife is a licensed psychologist here in Knox County. They are switching to telehealth. They are performing the assessments at home, obviously trying to manage a family, manage different, manage all of this going on in the household while still providing that patient care on the mental health side has been extremely taxing for her and for her patients, many of whom are children. And, how do you create an accurate diagnosis? How do you actually do the assessment properly? I would say that the resources need to be improved there. Absolutely. And I would say, generally speaking, mental health resources need to be improved, but especially right now.
Thank you, Eric. That's going to lead me kind of back to Mike. Mike, I'm going to go over to the question here that's in the question and kind of lead this with you because of some of the things I know that you do in your senior vice president CIO position. How do we improve I guess what I call the collaboration between the healthcare science and our policymakers? I know that you're on ETHINs in the 23 counties. You deal with a large board each time, and those people are, they're policymakers. How do you see some of that? Have we had this whole pandemic and it's changed our entire view? And are the policymakers seeing things more futuristic now? How do you see that, and how are you working with that, Mike?
Well, number one, you got to take ownership. So some folks want to be a little disengaged or a little removed, and they want to sit back and be a backseat driver or an armchair quarterback, and what you see across the community. So I know there for a while it was daily. It's always been that co-opetition that I mentioned. Has always been something where we were cooperatively competing. And that I've been here at Covenant 17 years, and I can tell you it's been here for 17 years. I have frequent meetings. When you look at it both at the technology level and CEO level, I can cover both. So the technology guys meet on a regular basis. Michael Sod and I we used to do breakfast every month, but we hadn't done that for the last 2 months, and you can guess why. But we have a virtual meeting tomorrow afternoon. John Hanks at Children is someone that I meet with on a regular basis. So we're always there sharing. John Jeffries mentioned it about how do you share that. If it's security related things, there are avenues by which you can communicate those concerns up to THA at the Tennessee level, TMA at the practice Tennessee level. You can go up to AHA. I know that all the entities have lobbying efforts. I can do that in air quotes. Don't put a whole lot of money into it because it takes money to do it, but we do that to where it's that collaboration up to our senators, to our representatives. When you step over to the oversight and where is this telehealth going, one of the big things that everybody needs is reimbursement. So at this point in time, it's episodes of care. Those situations and settings of care are typically in the hospital or a practice setting. We're not getting reimbursed today. Everybody might think, well, if you have a virtual care issue, there's going to be a few exceptions now during the pandemic time, but we hope that gets sticky and it stays, because after the fact, we need to get reimbursed for that technology that we've invested in and put in place. But a lot of the payers, and that's where the money in healthcare is, it sits in the payers' pocketbooks. They're holding it from a risk perspective, which on one hand makes sense, but not the amount that they're keeping. But we are lobbying to the people that we're doing. So it's a peer lobbying, so to speak, but then it's also an up the chain lobbying, because I know the CNOs, the CMOs, the CEOs of the organizations are involved trying to work all the way up to the governmental level to make some changes. Now, there is one thing I want to say, because we're sitting in the lowest reimbursement area in the nation. There's some files that I can flip or share with the Technology Council if there's a resource to be able to put that up, and you can see where Knoxville, Tennessee is on the bottom of the reimbursement chain. So whenever Eric and his team, if they've got these tests that are available and innovations that's being done, one of the challenges for adoption here locally is because we don't get reimbursement for a lot of things. That's going to be an area, other areas of the country, New York, Chicago, California, they get it quicker. They have the political ear typically because those are the areas that have it all. Well, I can tell you, I'm proud of the innovation and the collaboration that I've seen here locally. We set national leading results, but we do not get national leading reimbursement. I'm going to shut up and hope I answered your question.
You did, Mike, and that what you just brought to light to many of the people who are on our virtual tour here today. The Tennessee does have the lowest reimbursement, and telehealth is something that has to be approved through the payer organizations. And like Mike said, if you're in the state of Ohio, you're in the state of New York, it's a much quicker, much higher percentage pay. And once again, not the fact that nonprofit or for-profit, the nonprofit organization doesn't mean you're not trying to make money, you're trying to cover cost. And sometimes that doesn't cover the cost. And Mike, I will say that many of the people out here, I think we COOPETIT cooperation. We love that word. The chatting line over here loves that term, and it is something that I do appreciate between all of the organizations, the healthcare organizations that they're in Tennessee or actually in Knoxville. Is there any other? I guess I want to just say legal implications or anything here, folks, that we as we triage and do all these things with the nurse oversight? Mike, Jared, I mean, you gentlemen, is there anything with this whole nurse oversight that we may be worrying about? Is there any big concerns from TeamHealth or Covenant or UT? Mike, I'll let you go first. I got you unmuted. You're unmuted.
Well, so I'm, I was holding back because I have a tendency to jump in. Tommy knows me over all these years. I mean, certainly there's the concern, but like John has mentioned, we have a lot of collaboration from the compliance side across the community, across the privacy side. And so we're all learning and we're building, and we will share information and perspective and approach with each other because we do want to stay in lockstep. Number one, I call it the Proverbs 24/6 model. For waging war, we need guidance. For victory, many counselors. And so we have people that are sitting down that have that expertise, and we can stay in lockstep. Two heads are better than one is a simple way of saying it. So we make sure that we've got the legal aspects covered. Now, there is this point of with a chatbot perspective. So if the patient engages and they are consenting then to be able to use the technology, they're sharing some information. But again, that information is not saved. It's not retained. It's a process by which we triage. And then if it steps to a next level, even with the nurses, we're not saving that data. We're just going through a decision tree process to be able to say, do they need to go to the next step? So part of that, whenever they come in, number one, they've consented by engaging. Number two, we get them to sign a consent that they say, yes, we understand this. But number three, we're not retaining that data. And the service relationships we have with our providers, they're not retaining that. It's just transitional. Then if they come down to where it's a care setting and they're engaging with a physician or a nurse and it becomes part of the patient record, all of that then falls back into the records that we're all on the TeamHealth side, UT, Eric's side, we're all saving that and protecting it because it's PHI and we're treating it as such.
Yes. Thank you, Mike. That's so true, and I know many of our people will understand what you're talking about with HIPAA and all the other requirements that we have to keep and keeping for the privacy of the patient and for their their protection. I don't have any other questions. I mean, I'm looking for questions out here, folks. Is there any other questions and so forth? I'm going to go back. I'm going to ask one last question of all of our panelists, and if I can get Alex to maybe unmute Eric here and so forth and the team. So far, Eric, through this whole COVID-19, what has been the biggest lesson that your company has learned so far, Eric? What's the biggest lesson you and your company have learned?
I think the biggest lesson is to be agile and flexible and to communicate with with employees, with stakeholders, with our customers, and with the community in general. We've had communications with UTMC. We've had communications with Covenant Health. We talked a little bit with TeamHealth as well, and Tenova here in town. So, being flexible, making sure you can respond to anything that gets thrown your way, and to communicate that strategy and stick to that strategy, keeping it flexible enough that you can adapt.
All right. Jared, what do you think the biggest lesson that TeamHealth has learned from this COVID-19?
I think, there's two big takeaways from my perspective. And this maybe dovetails in one of the questions that was put out earlier. One is making sure that as we are adjusting to change and people are starting to live in a new normal, whether they're in the administrative or clinical settings in terms of what they're facing today, making sure that people have the appropriate support and make sure that they have the resources that they need to know that they are supported, to get guidance on any concerns that they have in terms of how they can be tested, how they can report, and feeling support from the company. From a technology standpoint, I think this is shattering, in my opinion, our notions of working remotely. And I think this is going to be a permanent culture shift across all companies in terms of how we begin to be more open-minded to letting people work remotely and delivering the tools they need to be able to do that. I think this event is not going to be something where we just go back into the offices as we were. I feel like this is a, life-changing, work-changing shift that will introduce more tools like telecommuting, telemedicine in the field, and really give a stronger platform for those to be used more on.
Yeah, I think you said earlier we all need to invest in the video technologies and so forth at this time. And I think I saw something the other day where cameras were at a short supply, and what used to be an $80 camera is now a $250 camera.
Yep.
John, from UT Medical Center, what do you think has been the biggest lesson that UTMC has learned from this so far?
I think if you talk to anybody at UT Medical Center, you would see that the collaboration within UT to overcome these challenges has been phenomenal. From my perspective, collaborating with the other local healthcare facilities, my awareness has been just surpassed of what I expected. And I had no idea how closely the CEOs work together, the chief nursing officer, the CIOs, and so it's been exciting to see the collaboration internally, but externally as well. And, Mike alluded to it earlier that we're walking in sync as we go through this process, and the different entities are doing that together. And it's just been amazing to see that collaboration.
Yeah, community spirit, collaboration, and hospitalization. It has been exciting. Mike, I'm gonna come and let you close this out with what do you think has been the biggest lesson that Covenant and yourself or your organization has learned from this entire endeavor as well, Mike?
Well, I think one of the things we've learned, and I shared it with my executives this week, is we didn't have a technology problem. We had plans, and we were already working to put it in place, but the technology was there. We just had to be able to say, culturally, are we willing to accept it and utilize it, to adopt it? And so what we've seen now is physicians that were at one point a little apprehensive, they were never reluctant. Not everybody's got a made for video face or personality. And so they're having to learn through, and after they see it modeled a little bit, they very readily adapt it. I want to mention one thing too that I think is a learning that I want all of us, because this is the Technology Council of Knoxville. Jared made some hints at it. I think that there's going to be a lot more openness to utilizing technology, but it's the responsibility of the people that are enabling that technology to make sure that culturally, Covenant, TeamHealth, EDP, UT, US Bank, these companies have got to be able to get productivity, because people, when they go home, they may have a tendency to say, well, I can be a little more lax, I can be a little more flexible. That's a privilege that people need to be able to appreciate and bring back, and make sure that these companies that are enabling all that get the benefit of that. Because if they don't, it's going to get shut down and it'll get collapsed. And not that it wasn't bad how we were doing it before, but how can we take the best of both worlds? There's some compromise and flexibility that we all need to reflect on and take away.
Right. That's a good point.
Yeah, Jared liked your point there. His head was shaking the whole time you were doing it, Mike. And you're exactly right. I know there was a report that came out this morning from LinkedIn and several other organizations that are monitoring all of this working from home. Many of the things were very positive, but obviously we have to continue that trend. One of the things I did hear on that report this morning was the fact that loneliness, working from home kind of was a little lonely for some of the people. So that is a culture change. It is a shift. But I digress slightly there of reading the newspaper and watching the news articles myself. And Mike is correct. I do work for US Bank, and obviously we have in Elevon, we have 152,000 employees worldwide. I actually have a team of 100. All 100 of my people work from home now. They have that technology. They understand the importance of their jobs, just as we as healthcare workers do as well. We're supporting an organization, 3,800 branches across the United States. We've got about 85% of those open today. But once again, I go back to our healthcare here in the East Tennessee area. I certainly appreciate, Eric, everything you're doing with your organization. And, I'd like to say that it was so timing perfectly. You're on the front page of the newspaper today. You're in front of us this afternoon.
Better.
Jared and John, you couldn't have timed it better. You're running for office, right? You're going to run for an office. But I do appreciate your all's time today. And Mike will tell you, I have a face for radio, but I am trying to adapt to the new technology of seeing people as we all work from home. I think this will be endeavors for the future. I do believe, as Jared and Mike have both spoken to, this is a change. A grave situation has made us get to some points of where we had to make some choices. And I do appreciate everyone's choices that your companies have made and you all have made as individuals and have led them at this time. Well, at this time, I have to read my notes over here, folks, for 1 second. I do want to thank you all for attending this KTech event. Please remember that you can visit knoxtech.org to stay updated on the KTech membership, events, news, and networking. The event will remain open till 1:30, so you can do some networking opportunities, but I do look forward to seeing you at our next KTech event, folks. And as you see, I read my script very well. Thank you all for your time, and certain panelists, I appreciate you very much.
What a great moderation and what a great panel. Thanks, guys, so much. I want to request one thing, though, because this was such a great event, and we continue to go into the networking. Could I get you guys? I'm gonna hop off stage, but let's get a screenshot of everybody. This is a good group, so I'm gonna hop off, and then after we do that, we'll jump into the table networking mode. So thanks again, everybody, for coming, and thanks for the great discussion.
Thank you, Alex. Y'all have a great afternoon, everyone.